the other aspects of my job is doing one-to-one interventions, getting to work individually with some of the clients that come into the acute ward is really helping them to, I guess, find what type of skills and supports they're going to need once they leave this environment.
So we look at not only their recovery in terms of clinical recovery, but also social and personal recovery. We help link people into services within the community to increase social inclusion and help a bit of role identity and improving a bit of independence.
Some of the skills that I bring to the HOPS team is around having an understanding of engaging in meaningful activity and trying to develop social connections and developing a sense of connectedness to the community. And they often, people talk a lot about social inclusion.
We think about the occupation that is meaningful to people. So to be able to do that, we need to be able to get an understanding of what's important to people, people's values, people's previous experiences of occupation. So we're always interested in occupations throughout the lifespan. So at any age, people's occupational experiences affect how they engage in occupation now.
So I guess our role at CCU is to look at a person holistically and help them, I suppose, on that journey to recovery. And a lot of the time we're, I suppose, holding the hope for them, trying to get them up in the morning, get them tap into their motivation. So as OTs, we look at their level of function, how we can go about improving that.
One of the most rewarding things for me working in this city is that it's the relationships that you form with the people while they're here. And some might be around therapeutic alliances, whereas others might be just around hearing what their story is. I guess too, in terms of the tasks that I have here on the ward as well, is there are a range of assessments that are available as an occupational therapist for me to undertake, and things include such as the assessment of motor and process skills, the low-host assessment tool, the volitional questionnaire, and those assessment tools will give me a wide variety of understanding of what's happening for the person. In addition, with undertaking collaborative practice with the patients, I'll also work with the families as well, because they're just as important as the person themselves, especially when they leave hospital. Potentially where the person's going to is back to either their partner, family member, next of kin, or even a housemate that have been living together for a number of years.